Up until the 80s, doctors believed that ulcers were caused by stress and spicy foods, but now it's widely known that ulcers are caused by bacteria, which can sometimes be cured with antibiotics. The culprit? Most likely Helicobacter pylori, or H. pylori for short. The stomach bacteria can cause peptic ulcers, which are open sores in the lining of your stomach or your small intestine. While many people can be infected with H. pylori, not everyone goes on to develop ulcers. Scientists still do not know why that is. People who do go on to develop peptic ulcers may end up in their doctor's office with some very uncomfortable symptoms, including nausea, loss of appetite, bloating, and weight loss. The specialists at Advanced Gastroenterology and Surgery Associates explain how they detect and treat patients with H. pylori.
It is a bacteria, but unlike other bacteria, it prefers to infect only in the stomach. All right, so therefore it doesn't go to the blood system, it doesn't go to the brain, it doesn't go to other organs. No one knows exactly how it's transmitted. Somehow it is ultimately ingested and settled into the stomach. It is a chronic infection that causes inflammation to the lining of the stomach. It can cause symptoms of pyrosis or abdominal pain, nausea, belching, so all those general GI symptoms. In the long run, it can cause stomach ulcers, all right? And if in a very small percentage of patients, it can cause stomach cancer called B-cell lymphoma. In the United States, there is not a screening program per se for every person who walks through the door, especially asymptomatic patients. So patients who come in with these generalized GI symptom, abdominal pain, nausea, bloating, the primary care usually will check a blood test called H. pylori serology. And if that is positive, then they will be treated. We also have capabilities to do H. pylori breath test as well. Let's say the patient presents to our GI clinic, and when we do endoscopy, we do biopsies, and we check for the bacteria that way as well. And of course, if that's positive, the condition is very easily treated with antibiotics and require 10 to 14 days.
According to the CDC, approximately 25 million Americans will suffer from peptic ulcer disease at some point in their lifetime. If you'd like information for Advanced Gastroenterology and Surgery Associates and their services, just click the Key to a Cure story link icon on our homepage at yourhometownhealth.com.